Hello everyone, welcome to Manika IAS. Welcome to the daily news analysis session presented to you by Manika IAS. So, we'll first look in the topics that we'll be covering today, and they include cervical cancer. We have discussed this many times, but today we'll be discussing about the global success stories and also the example of Sikkim and what are the challenges. Okay. The second is Supreme Court on felling of trees in Jim Corbett. So we also discussed about this topic yesterday. So if any of you have not seen that video, you may visit. But today also we'll discuss this topic again and with some new aspects added to it. The next topic is VSAT, very small aperture terminal stations. This is a new initiative to get connectivity in the rural areas. So we'll be looking after this as well. Then the last is Fund for Artificial Intelligence and India AI Mission. Okay. So under India's AI mission, the government has granted certain funds for artificial intelligence. So we'll be looking after this particular mission. All these topics are important for your prelims as well as for your mains. Specifically, these three are important for your prelims, and these three are important for your mains. Okay. So let's start with the very first topic, which is your cervical cancer. Cervical cancer. So Indian government, as we all know, has promoted vaccination for the age group of 9 to 14 years in the universal immunization program. Okay. So why there is a need of vaccination of cervical cancer? See, cervical cancer remains the second most common cancer among women in India, and one third of the cases around the world are coming from India itself. Okay, with 1.27 lakh cases and 80,000 deaths being reported annually. So this is a huge number. Since we want to curtail this, so that is why the vaccination program. Now, what is the causing organism? The causing organism is human papilloma virus, and the vaccination is available for HPV as well. Okay, so accordingly, the WHO has devised a strategy to eradicate the cervical cancer. And what is the strategy? It is 90, 70, and 90 targets by 2030. What does this mean? The first 90 means 90% of the girls will be fully vaccinated with HPV vaccine by the age of 15. Okay, and this has to be achieved by 2030. 70% of the women will undergo cervical cancer screening test by the age between 35 and 45. Okay, and the last 90 stands for 90% of the women with cervical cancer be treated. So 90% girls to be vaccinated, 70% women to be screened, and 90% cases to be cured. And as we have discussed earlier as well, we can treat cervical cancer provided we diagnose it in the early stages. If you do not ignore the conditions of your health and get the regular screening done, and if you are able to find out, identify the cancer in the early stages, it is a curable cancer. It is not something which is non-curable, but when it become malignant, it is very difficult to cure, and this applies to almost every type of cancer. Now, uh, what are the global success story? As I begin with the same thing, that we'll be discussing about certain global success stories, so we'll look after those stories and we'll see the takeaways that we can take to improve in India as well. So over 100 countries have implemented HPV vaccination program, resulted in a decline. Okay, now if you see the example of Scotland, between 1988 to 1996, not even a single case of HPV was reported who received fully HPV vaccination between the ages of 12 and 13. Okay, if when the HPV vaccine was given to the people, so these age group didn't reported any sort of cases. So this shows the efficacy of HPV vaccine which are available. Next is Australia. Australia initiated HPV vaccination for girls in 2007, and it also included boys in 2013, and it's expected to eliminate the cervical cancer in the country by 2035. And why we are saying that boys also, because human papilloma virus is not only responsible for cervical cancer, but it is also responsible for many other diseases. Some of them also include STDs, and that is why the boys were also included. Okay, if you take example of Rwanda, which is in Africa, they have been able to significantly reduce the prevalence of vaccine targeted HPV viruses, types of particular virus. Okay, who were participated in this HPV program in 2011. Okay, so 6 out of 11 Southeast Asian region countries have introduced HPV vaccine. In Southeast Asia, if we see our neighborhood, 6 countries have already introduced HPV vaccine initiative, and these include Bhutan, Indonesia, Maldives, Myanmar, Sri Lanka, and Thailand. Okay, so in our neighborhood, these countries have also initiated this HPV program. And if you see Bhutan, it was the first low middle income countries to initiate a HPV vaccination program for girls, and it has already achieved 95% of targeted girl. Okay, and they started this program in 2010, and now we are starting in 2023. So we are definitely at a lag. And they also initiated vaccination for boys, and it's also the only low middle income country which started the vaccination for boys as well in 2021. So this is a very good example which you can quote in your mains answer writing if you get a question. Okay, and if you see India's example, India may Sikkim model, if we see what is the strategy and what they have achieved. The Sikkim has achieved a vaccination coverage of 97% when they rolled out this campaign in 2018. Okay. So they have been able to achieve the 97% coverage of vaccination. And how did they do that? They educate teachers, parents, girls, healthcare workers, and media about the benefits of HPV vaccine. So, by spreading awareness and education, they were able to achieve this 97% coverage. Okay, and this is what reflect that if you have effective communication, if you are able to reach specifically in the times of social media, when you have immense platform and you can rope in many celebrities, influencers to actually who can make a significant change in the mindset of the people. So that is something that we can use if we want to tap on our communication effectiveness. Okay, so this was the Sikkim example. Now, what are the vaccine which has now been developed by India? That is Sarvavac. Okay, India की indigenous vaccine है. It is the indigenous vaccine, so you can get a preliminary question around this point as well. And it has been developed by Serum Institute of India in collaboration with Department of Biotechnology. And it's cheaper, so that way you can ensure the availability and accessibility. Okay, if you want to fight the infections and the cervical cancer. And India is also planning to expand the vaccination program and also include adolescent boys, and that they want to maximize the impact of the HPV vaccines in order to contain the HPV related diseases. Okay, so what are the challenges way forward, and what are the strategies that can be deployed? So the biggest challenge that we face in India, not only with respect to this particular disease, but with anything, is the vaccine hesitancy. People are ill aware, and they are hesitant to take up the vaccinations. Okay, so due to certain myths that vaccine can itself lead to infections and others as well. So that is one challenge. The strategy should be that you engage communities through targeted effort. You have to do away with misinformation. You have to burst the myth, and that is where we say that if you have, you can use effective social media and campaigns. Okay. Then equitable access. The challenge is to ensure equal access, particularly in underserved population. That means, see, India is a huge populous country, and we have seen that remote areas and the areas which are not well developed generally get a lack of accessibility. So, if you are able to provide it in any nook and corner of the country, this way you can improve the accessibility. And this is where they suggest that as we had a COVID platform, where we were able to track the real time deployment of vaccines and usage of it. Similarly, if you can utilize the UWIN portal on the similar pattern, you will be able to provide accessibility in the underserved population. Again, awareness and demand improvement, because people are not even aware of the vaccine, the benefit, its availability, as a result of which the demand is not coming from the population itself. So we have to push the vaccine into the population. Now imagine if population is aware, they will demand. Okay, so we have to increase the demand as well, and that is where you need to increase the awareness. Okay. Cultural and societal norms, they affect the vaccine acceptance. This is another factor which is come under your vaccine hesitancy. Okay, now the strategy is that you cater to the needs and understanding of the culture and social groups in order that you resonate, and this is the technique which is called persuasion. Okay, and this is where you can aware them. You can understand their needs and make them understand what is the relevance of the vaccine, and increase the acceptance towards the vaccines. And then you need to have collaborative approach. Challenges is the most difficult is to build trust and ensure program success. This need collaboration between the various stakeholders. And how do you ensure that you bring in various stakeholders on table, like government agency, community partners, healthcare providers, civil society organization. And this way, if you have multiple stakeholders on a single table, you will be able to build the trust. Okay. Then public private partnership. So if you want to scale up things, it is literally not possible for the government to provide this on a massive scale, so you need to have private partnerships as well to increase the equitable access. And then you need to leverage partnerships through advanced collective goal, safeguarding women health against cervical. And here you can also tap in the resources from CSR. Okay, now let's move to the next topic, which is your Supreme Court and felling of trees in Jim Corbett. So, what happened? Over 6,000 trees were cut down in Jim Corbett, and this, as Supreme Court highlighted, was a clear nexus between the politicians and the uh, officials involved. And the reason was to for some commercial purpose. Okay, so this is something which the Supreme Court has held illegal. And what was the observation? The observation was the presence of tigers in the forest is an indicator of well-being of the ecosystem. So if you are destroying the ecosystem, if you are cutting down the trees, you are destroying the ecosystem, you are encouraging human activities in the national park. What will happen? The population will reduce, and there will be an increase in human wildlife conflict. Okay, because you are encroaching in their space. That is what the Supreme Court observed. And it also said unless steps are taken for protection of tigers, the ecosystem which revolves around tigers cannot be protected. So you need to protect tigers, and that is where the Supreme Court questioned, do we need to have safaris in the buffer zone? So we'll discuss about this a bit later. But this is where Supreme Court also raised this question, that do we need to have safaris in the buffer zone, or can we be doing away with it? Now, events also said illegal construction, illicit felling of trees like one in Corbett cannot be ignored. So you should be taking steps in terms of preventing illegal construction and illicit felling. See, What happened is, once the trees are felled, the damage has already been done. Okay, so you need to prevent such things. Prevention is the way forward, because once the damage is done, now the corrective measures, if you even if you put in place, it will take years to restore that ecosystem again back. Okay, so that is the irony, and that is the sad part of it. Even if the Supreme Court is reacting, even if the case is there, and there are certain judgments which are being passed, the damage which was supposed to be occurring in by felling of the trees have already been done. Okay, and there is no shortcut of restoring the damage. Okay, you cannot undo that now. So that is the biggest issue. Now, as the Supreme Court asked, why safaris? Why do we need safaris in the buffer zone? So who decide that? The Central Zoo Authority and National Tiger Conservation Authority are expert bodies that affiliated by the Union Minister, Environment Ministry, and they are responsible for conservation and protection of wild animals. And this is where, when the laws are made by the government, they are providing input. Okay. Now, these organizations have no objection on existence of tiger safaris. Okay. Now, wildlife safaris is a designated spot. They take attention from the core zone and hence promote its involatile nature, and as well as raise public awareness about conservation is what the stand of these bodies. And they have also said that aim is to promote ecotourism and not commercial tourism. When we are promoting safaris, we are trying to promote ecotourism, we are trying to promote awareness, and it is not from the angle of commercial tourism. This is what the stand of the authorities. Now, what is VSAT stations? So, the Tribal Affair Ministry is collaborating with ISRO, Indian Space Research Organization, to deploy VSAT, that is Very Small Aperture Terminal Stations, on a pilot basis in 80 tribal villages in 4 states as of now, which is Jharkhand, Madhya Pradesh, Odisha, and Maharashtra. And the aim is to bring internet service according to the proposal that I have given. Okay, about the news, the ISRO will see the government set up stations. They will oversee. ISRO will be responsible for setting up of stations and the role play of technology. And the reason being, the locations are remote, have difficult terrain and challenges that have kept them out of the connectivity so far. So the non-connected and the places with difficult terrain are being approached here. Apart from this, ministry will also be partnering with AIMS to conduct advanced research on tribal health issues with emphasis on sickle cell anemia, and organizing training programs for doctors, paramedical staff working in tribal areas. So, where can you use this information? You can get a question on tribals, which is a vulnerable section under GS paper 2, social issues and governance. This is where you can use this point. And they're also planned for setting of Bhagwan Birsa Munda's chair of tribal health and hematology at AIMS. So these are the initiative for health, and this is for digital inclusion. So whenever you get a question around tribal inclusive development, you can quote these examples. And in prelims, you can get also like what are VSAT stations and what are the aim. So uske points make you can be getting a question. So that is something that you need to be careful about. Now the last topic for the day is fund for artificial intelligence. So the union government has approved a rupees 10,000 crore fund approximately to this artificial AI India AI mission. Okay. So what will be the role of the fund? Specifically in intelligence computing infrastructure and startups. Okay. It will be fulfilling the viability gap funding, and it will subsidize projects that may face steeper cost. Okay. It will contribute to application development, And the corpus is the center largest direct investment in AI so far. Okay, that means you see the government is focusing on artificial intelligence. And the graphic processor units will be made in public private partnership. This is where PPP is coming in. Okay, now let's see about the mission. So, see, what are the key features? These are the key features that it will improve compute capacity, innovation center, data sets platform. These are the seven pillars. India AI application development initiative, future skills, startup financing, and safe and trusted AI. These are the pillars around which the AI ecosystem of the country will be built. And this AI mission was launched last year, and it wants to democratize computing access, improve data quality, develop indigenous AI capabilities, attracting top AI talent, enabling industry collaboration, providing startup risk capital, and ensuring. And this is where the fund that has been providing will be fulfilling the viability gap funding and bolstering ethical AI. So this is the role, basically the aim of this particular mission. So, if you get a question around this, you can quote this seven pillars of the seven key features of the mission. So, this was about today's daily news analysis. And if you have any question, you may please ask in the comment section below. Thank you. Have a nice day.